Andaman7 is a personal health record application that runs on your smartphone, so that it's a way for you as a patient to collect the data from your hospital, from labs, from your doctor, from basically all the sources of health data, and store all of that data on your smartphone. It's completely private, it's quite secure, and you are the only one to be in control of your data, and you can decide to share it or not. That improves the care you receive, obviously, but it also allows you to contribute to research, for example, medical research for finding new treatments. So in the case of DataVaults, the European projects that we are part of, we plan to add a few new features to the Andaman7 application, which will facilitate that part, the research part. The goal, for example, is to store after patient consent. Of course, there is always a patient consent before sharing any type of health data. After patient consent, some of the data from the PHR, from the personal health record, will be stored directly on the DataVault personal server in encrypted format, as been explained before. And that data then could be used by some medical researcher stakeholders, like pharma companies, like hospitals, to do research based on your data. And your data, in most cases, will be anonymized. It's also a part of the consent of the patients. So that's one example, the data from the health record that is going to be shared through the DataVault system. Another example is questionnaires that could be sent to patients to ask them about side effects and various other questions about a new drug or a new treatment. And that data could also be shared via the DataVault system for improving or reducing cost of research. Another example in the other direction, I should say, suppose that there are health data coming from various sources on your personal DataVault on the cloud. With the Andaman7 application, you will have the possibility to download that new data and store it locally inside your PHR, inside your personal health record on your smartphone. So we plan to have data exchange in both directions, and the main goal is to empower patients and also allow them to contribute to research, always after consent, so that privacy is fully respected and we have a high degree of security.